Hi, this is Brascheck, and we're recording this on the first day of April 2020, and I'm following up on something that we've posted before several times, and I got to be honest, was reluctant to post it then. I'm a lot less reluctant to post it now, and my reluctance comes from the fact that I can't believe that we're the only people seeing this, but finally I'm seeing an article that puts some teeth to our intuition here, which is that, in fact, this virus is being spread by hospitals. There doesn't seem to be any doubt about it now, and it's the same path that I laid out before, which is someone gets this thing somehow, however they get it. They end up in a hospital. They're treated by hospital workers. The hospital workers do not take proper precautions. Part of it, they don't have the right equipment, but we're going to get to what the other big problem is in a second. But however it happens, they catch the virus, and then they pass it around to their fellow workers, to other patients, and then they go home with it. We pretty much now know this is exactly how it's happening. It's how it happened in Wuhan. It's how it happened in northern Italy, and it's how it's happening in New York City. We're seeing these same numbers over and over and over again. What percentage of the population works in a hospital is pretty darn small, right? It's not that many people. And yet, they often make up 20% of the people that have this disease. When reporting is actually done, we see patterns where a huge percentage of the first infected reports are in hospitals. And so it's not just people showing up with the disease in hospitals, it's people catching the disease in hospitals, and that would be other patients, and that would also be healthcare workers. Got to say this too, got to throw this out real fast before I forget. In Italy, they're now redoing their numbers, and it appears that only 1 out of 5 people truly died of the virus. They happen to have died. The people died also happened to also have the virus, in addition to heart disease, emphysema, diabetes, obesity, and 10,000 other ailments that people have. But anyway, we'll leave that horrifying number aside. In other words, the number of deaths and the number of deaths is being dramatically overstated. So, but we'll leave that aside and focus on how to stop the problem, which is something has to be done in these hospitals. So Fox says that state officials say in Minnesota, 1 out of 5 confirmed cases of COVID-19 in Minnesota are health workers. Here's I'm reading from Carl Denninger now. The data says that what is happening is that this virus spreads in the population, but slowly, until healthcare workers get it in a hospital, pass it around, and then back into the general population because they're exempt from all social mandates. In cities with a strong public transportation system, it's even worse as they can spread the virus on buses and trains. And the people that are doing the actual work are the nurses, the orderlies, the maintenance people. They don't go home in their Mercedes. They go home on the subway. So Minnesota's coming next. Now, more data. The data proving this is clear. Now, here's the bottom line. When New York implemented its shelter in place, and other towns implemented their social distancing, we should have seen an immediate collapse in those areas that put these things in place, right? Nobody's interacting. That should stop the passage of the virus. The virus doesn't travel by magic. So if people are not interacting with each other, then that should bring the thing to a screaming halt, but it did not. There's been a change, but it's clear that casual social interaction being cut by 90% or more for the common person on the street is not stopping the transmission. So if that's not stopping the transmission, where's the problem? Why is this thing exploding if people aren't interacting? And the answer is, if you're laid, here's the thing, people are being laid off, so they're not at work. They're staying at home, since everything they normally do is closed. So it's you, as Carl says, and your cat. So what percent, what part of the population is left out? Hospital workers, who by definition cannot socially distance and do their jobs. So just to dial this back, we've got, basically a cessation of all normal social interaction, but we're not seeing a cessation of explosion in the cases. Fully, and I wish I had the percentage, I don't know what percentage of people in America work in hospitals. I guarantee it's 1% or less. It can't be any more. All right? And yet hospital workers are accounting for 20% of the cases. I bet it's going to be discovered that the other 80%, well, we know the patients in nursing homes, the patients in hospitals are getting it. Everybody else must be getting it from either being in a hospital or being in touch with somebody in a hospital. So this idea that this is the super transmissible virus of all time may be wrong. All right? So what's the solution? And the solution is apparently heartbreakingly simple. Singapore has identified the problem and stopped the madness by mandating that hospital workers wash their hands with soap and water, not sanitizers. And we've had videos on that. These sanitizers, you only use them if there's no other option, and they have a lot of flaws. Okay? And we've run the video that soap and water is the magic here. Sorry that it's cheap. Sorry that it's simple. It happens to be the magic. Excuse me, I'm going to cough, not because I have the virus, but because my throat's a little dry. Okay. So Singapore identified this immediately and stopped the madness by mandating washing of hands with soap and water, not so-called sanitizers, before and after each contact with a person or thing that could potentially be infected. So before you touch something and after you touch something. Before you contact a sick person and after you contact a sick person. You wash your hands, or if you're a hospital worker. That's clearly not being done now, nothing even close. When Singapore did that, they dropped their infection rate of their hospital staff to a statistical 0. And almost immediately thereafter, the outbreak there was under control. Okay, so they still get a case here and there, but the simple fact is that despite the screams of horror about community spread, the facts are that, here's the emphasis, it isn't that easy for social transmission of this bug to take place except through super spreading events. And that probably would include this tight little rooms with a lot of people packed in and no ventilation. So there may be businesses that need to stay closed for a while, but not the whole world. People can work in warehouses. People can stock grocery shelves. I mean, there's a lot of things. Well, people are doing that now, but people can do that safely. Those, by the way, those are the only people that are out and about. If this thing really did spread easily, then all the stuff that we've done the last 2 weeks would have stopped it or slowed it down immediately and dramatically, right? I mean, there's just logic. And also, Singapore couldn't have stopped transmission to health workers by mandating strict hand hygiene standards, but they did. So that's what they did. And we have repeatedly seen this pattern where you have a case here and there, a few people show up in the hospital, and then sudden exponential explosion occurs after failing to follow the predicted geometric progression for weeks. And it happens in city after city. Social distancing doesn't stop or reverse it, and neither do stay-at-home orders, even when backed up with the threat of fines or worse. So, I mean, is there anything illogical here? If hospital workers are not scrupulously washing their hands with soap and water throughout the day, every time they need to, they're going to get it. And if they get it, they're going to pass it on to their fellow workers, and the staff's going to pass it on to the people already in the hospital, and the healthcare workers are going to go home and give it to their families. That's how, I mean, I can't believe that it's that simple and that so much horrific damage has been done not only to people's health, but to people's finances. But it looks like it really is that simple, and it is the logical answer here. If you dial back, these cities are fine, and then they get a few cases, the few cases go to the hospital, and then the thing explodes. While everybody is staying at home and locked up. The only place where there's a free flow of people coming and going and close social interaction going on anywhere is in hospitals, and you know, it just makes sense. So, if you have friends and family that work in hospitals, you might share this with them, because here's the thing: if we don't do this, this can go on forever. We've already triggered a serious recession that's going to take many, many months to dig out from. We're on the verge of triggering a once in a century level depression. People talk about the world not looking the same after this is over. It really won't. A lot of wonderful institutions, a lot of small businesses, will not be able to come back from this. If this, I mean, there are already some that are wiped out and won't come back. But if this persists for months and months and months, we're going to see a big cultural die-off of important institutions. Not the military, they'll be around. Not the police, they'll be around. Not the political class, they'll be around. But all the things that make life worthwhile, we're going to have less of those. The tragedy of this is this never needed. It's starting to look like this never needed to have happened, and the numbers are clear as day. And I pointed this out in an earlier call. I see hospital administrators all over the country saying, "Oh, it can't be us. They must be bringing it to the hospital." I mean, how self-serving and ludicrous do you have to be? But it's the case with the masks. The masks would definitely help for people that are in contact with lots of people, and we have a shortage of them. And instead of being honest about it and rallying the country, everybody who can sew, to start sewing masks for those who need them, which is not everybody, it's a very specific group of people, especially hospital workers. Instead of that, you turn the news on and it's a big political battle. Oh, Trump's right, Trump's wrong. I mean, who cares, right? It's not helping anybody. So they're not telling the truth about the masks. They're basically saying, you don't really need them. But the truth is, we don't have them. So we're going to tell you don't need them, because if you knew how much certain workers really need them, those that are in close contact with people and sick people, people would lose their minds. So they're willing to have See, the problem's solvable. There's a lot of people that can sew. There's still a lot of garment district industrial capacity in this country. There's still a lot of small factories. I mean, if the word went out, here's how you make these masks, go to it, we would solve the problem, the mask shortage problem, really fast. For instance, did you know that the filters of vacuum cleaners are almost as good as the N95 masks, the material? So you could make a simple cloth mask, which a lot of people are able to do, and leave a pocket in it and just get some of those those vacuum cleaner bag filters, clean ones, new ones, of course, and just slip them in the space, and you've got a pretty darn close to N95 face mask done. But they don't want to. They will not admit it. They will not admit the severity of the problem, and they won't. And they won't invite the public to help solve the problem. They are going to let people die, apparently let the economy go to ruin, so that this, we've talked about what a monstrous, corrupt edifice the medical industrial complex is, and that includes its tentacles into government, and they're malignant. I didn't start saying this yesterday. I've been saying this for years, and that malignancy is really coming into full expression now. So that's the news on this, and this is Brass Check.